Hi friends, I have the great honor and pleasure of having with me Dr. Vishnu Prasad, rank 2 AIIMS November 2017. Awesome rank, great result, a great student, a very intelligent boy, and I'm sure we all are looking forward to talk to him. Congratulations.
Thank you, sir.
How are you feeling?
I'm feeling great.
Just great?
Yes.
So what is the feeling that goes through your mind when you get a rank 2, when you read the rank 2 written in the notice board and you see in AIIMS notice board rank 2, what is the feeling?
Like for the initial 1 hour, I was feeling numb.
Numb, yes, no feelings.
Yeah. And then I felt the excitement.
Yes.
It's still there.
Now, it's still there. Great.
Yeah.
And do you want to actually, utilize this opportunity in the beginning to maybe thank some people in your life who have been through you, through all this with you?
Yeah, I would like to thank my parents and my teachers, everyone, my people who taught me, and of course people in DAMS. Everyone contributed to this achievement. So I would like to thank them. Yeah.
And you were a student of our foundation course.
Yeah.
And so you joined us in your third minor, third minor year. So what was your experience at that time? When you joined, at that time, you must be in your formative years.
Yeah.
And how did joining the classes at that stage help?
It helped me, all the classes were very good. So I used to prepare notes of the classes, and then the notes really helped me in every stage, like even during my professional exams and this entrance as well. These notes were the key to my revision. So it did really help me a lot. The classes helped me clear my concepts and make a good base for my revision. Yeah.
So primarily, at that time, first of all, probably you got introduced to the idea of competitive exam coming your way, because I think by the end of second year, you kind of, the euphoria of getting into the medical school ends, and then the next challenge comes into place. And I also want to know about, at that time, a lot of teachers would have influenced you by their way of teaching in DAMS. Anybody in particularly you want to thank or say something today?
I'd like to thank Ruchi ma'am and
Ophthalmology.
Ophthalmology, and yourself.
Thank you.
Thank
you.
The two most teachers who influenced me the most. Yeah.
So, and I also want to know that you utilize the test series platform as well.
Yeah.
So what was your experience with the test series? And did you enjoy practicing exams? Because I feel that is something which has not, many people don't talk about it. Most people would talk about study, but I think practicing questions is again an integral part of getting a rank like yours. So how did you go about practicing papers?
I started giving the test series in my internship. I used to give initially. I used to give one test per month in the initial 6 months, and then I gradually increased the frequency, and then I used to give one test every 2 weeks, and then weekly.
Okay, tell you a little bit more about it. That when you give a test, and then how do you analyze yourself? Because a lot of people, a lot of candidates would be giving the test, but after that, what do you do? Do you look at things that you do wrong?
What I did was, I used to give the grand test initially, and then analyze what I actually did for the analysis was I did not spend it, the whole of analysis for the whole 200 or 300 questions would take 2 hours. So I did not spend the 2 hours in a stretch. What I used to do was that I used to save the answer key of the test in my mobile phone, and I would utilize my whatever free time I would get, like walking here and there and going to the ward or sitting in the OPD. I would utilize that time for revising the questions and looking at the questions which I did wrong, and why did I mark the wrong answer, why didn't I mark the correct answer. And that's how I utilized my time. And in the last 2 or 3 months, I would give subject-wise tests, and then I would revise the subject and then give the test for the respective subject, and then analyze it.
Okay. So I think you have actually given a very good strategy to people who are actually listening to you, because when we were preparing at our time, we did not have mobile phone at that time. It was very expensive to buy in internship a mobile phone at my time. So we don't have a mobile phone, but we used to have small books you know, small pocket books of some paper and all. We used to carry it in our, you know, lab coat or apron. And any time in the ward you get time, we would utilize that time to look at some questions and revise. And nowadays you have that opportunity. That mobile phone is actually a computer in itself. You have everything inside.
Everything.
And that's so portable. You are anywhere you're going, and in duty. And so because reason I'm, you know, emphasizing on this here is because many people will crib that internship is so busy that I'm not able to study. But look at him, ranked 2 in AIIMS with internship, and he utilized that internship also while, you know, when he's going around some MCQs he could see at that time, some things that he's doing. So there is all smart use of timing that he has done has actually paid him dividends, is what I feel so far. Okay, and a lot of people have asked me to ask you this question, that how many questions did you attempt in this AIIMS exam?
In this exam, out of the 200 questions, I attempted 198 questions.
And actually all the top 50 rankers that I've talked to and I've you know, discussed, and I've seen everybody has done 195 and above.
Yeah.
And probably the reason is the paper was not very difficult, it was doable. And when you see a doable paper in an exam like AIIMS, where you know it is like about getting into top 50 to get a good clinical seat in Delhi AIIMS, so you have to be a bit more aggressive. And I'm sure, you know, that busts the myth that, you know, everybody is, sometimes you listen people saying that, you know, avoid negative marking to get into AIIMS. It's not like that. It doesn't work it like this. So that is the key. That's why we have asked all the toppers this question, that they have all attempted 195 plus, because the negative marking is 1/3. That makes sense to do it.
Like I found that in those questions in which we have confusion between just 2 options, and I have ruled out the other 2 options, and I have only confusion between 2 options, then I think we should go for the answer rather than skipping the question.
Yes.
And you should weigh the options, and the one which you find would be the most appropriate option, you should go for it. Did
you utilize your first instinct to mark the answer? Like sometimes, you know, you're not sure what to do, then do you go with your first instinct, or do you change the answer later on?
I did not change any answer later on, because for reviewing the question you get around maximum 5 minutes in the end. During that questions, if you are reviewing the questions, you just view at one question for 5 seconds. And I don't think you should change the answer in that 5 seconds, because you have the first answer which you have marked you would have taken around 1 or 2 minutes to reach in that answer. I don't think you should change the answer when you are reviewing it, unless unless if you are very sure about the answer, only then you should change it. Otherwise, you should not follow that instinct.
Yes. And what I've seen is in the last 5-10 minutes, and suddenly you get panicked. Oh my God! I should change the answer, and you actually have done it in the first go rightly, and you change it to a wrong answer. It happens. So I think that is a very important point. And how a lot of people would actually want you to tell them is what was going in your mind when you were giving the exam? Were you with a very cool mind doing each question at a time, or what was your strategy in the exam itself? Because, you know, you have to understand that rank 2 is a dream rank. You know, a lot of people would want to be in your seat next year. So they want to know from you, how did you approach the exam?
Initially, I made a plan that I would, there are a total of 200 questions and you have 180 minutes, that's 3 hours. So I planned in such a way that I would do 70 questions in the 1 hour, and then 70 questions in the second hour, and then the remaining 60 questions I would do in the last hour, so that I can get around at least 5 minutes for the review of the questions which I have marked for review. Initially my pace was slow. It happens initially takes
first few questions you take
more
time.
Around the initial 50-75 questions you would be going slow, definitely slow. And then you look at the time, and then time is running. So then one strategy I found useful was that in AIIMS exam the length of the questions is very huge. Almost all of the questions were at least 2 or 3 lines. Only just around 10 or 20 questions were single sentence questions. So one strategy I found useful was that towards the end, the last 50 questions or so, when I see a long question, I would first read the options first, and then read the question, so that I can look in I can roll out the options and then mark the correct answer. I think that would be that would save a lot of time.
Yes. That's a very good idea, because
Mm.
what happens is if it's a long question, it is usually the end line and the choices, they
Mm.
mean more than the entire question. So once you see them
Yeah.
and when you read it, side by side, you're ruling out also.
Mhm,
So that
mhm.
saves time. It's a very good idea that you shared.
Mhm.
And we also want to know from you, like, like a lot of people have asked me this question is, what are you going to opt for? What is in your mind? Which subject will you take?
Uh, I'm thinking of taking up radio diagnosis.
Okay. I'm very
Yeah.
happy to hear that. And what about like any advice that you want to give? I'll divide the advice into two now, because
Mhm.
you've been very kind in sharing what you have done. I want to divide the advice into two types. One is academic advice. Like, can you enumerate some high yielding topics for
Mhm.
the upcoming AIIMS, which you feel as a aspirant, you must have,
Mhm.
created a list of to do things for this AIIMS.
Mm.
And now that you are through and you are going to become a radiologist in AIIMS,
Mhm.
now can you advise other people that what do you think they should be reading for next AIIMS?
I think there are a few subjects which are the most important, which include emergency medicine, and then general medicine as such, and then surgery and pathology and micro.
Okay.
These are the most important topics. I mean,
Most stressed upon
yeah,
topics, yeah.
stressed upon.
Yes.
I mean, if you these are subjects like if you study those subjects, then you can score good marks. So I think you should focus upon these subjects more.
And anything would you want to say to people as a motivational message from your side? Like, we motivated you when you came to us
Mhm.
in your third year, and now it's your turn to motivate other people. What would you tell them? What is the secret that you want to them to do to reach higher in life?
I mean, everyone should understand that anything is achievable. Like even first or second rank, it's not so tough. I mean, the
Once you
key
reach there,
would
it
be
becomes easy.
yeah. I mean, the key is revising a lot of times, at least 2 or 3 revisions. I think it would be fine enough for getting a good rank, decent rank.
So if I summarize his mantra is that he started early, he remained calm, he practiced enough tests, he emphasized on giving tests as a practice, and he made a strategy of how to use grand tests and subject-wise tests in the end, and so for revision.
Yeah.
And he kept a calm mind in the exam. Even before he went to the exam, he had a plan in mind that, okay, this is how I will divide my hours. He did not leave too many things to review later on. He did not create a panic situation in the exam. It was all calm down exam. He went more aggressive in his attempt. He attempted more than 195 because he felt the paper was more doable. And in the end, the result is in front of you. He's ranked 2 in the AIIMS. So I'm sure you can see for yourself, this is the strategy, this is it. And sometimes, people overdo it, underdo it, they don't understand. There's no secret formula. And in the end, he's himself, in his own words, summarize, everything is achievable. Okay, so I want to sign off with this note for everybody. God bless you, and on behalf of the entire DAMS team, I wish him all the best.
Thank you,
I am
sir.
sure the country would have a great doctor with him in future, and I'm sure we'll read about him more in future with his more and more clinical work that he will do in future. God bless you. Congratulations once again.
Thank you, sir.